This oral powder is used to relieve constipation by increasing the bulk and water in your stool, making it easier to pass. It works by causing movement of the intestines and can also be used along with a proper diet to treat high cholesterol. The recommended daily dosage for adults is 1 to 2 teaspoons mixed with 8 ounces of water, 3 times a day. It is best to take this medication with a full glass of water, and it is important to drink plenty of fluids while using this product to avoid potential blockage in the throat or intestines. When taking Konsyl Formula D 3.4 gram/6.5 gram oral powder, make sure to follow the directions given by your doctor or on the product package. To prevent choking, be sure to take it with a full glass of water or other liquid. If you are using the powder form, be sure to measure each dose according to the directions, mix it with a full glass of water, stir completely, and drink right away. The dosage of this medication will depend on your age, medical condition, and how you respond to treatment. It's important not to increase your dose or take it more often than directed. Also, be aware that this product may decrease the absorption of other medications you may be taking, so be sure to take it at least 2 hours apart from your other medications. It may take 1 to 3 days before you start to see the effects of this medication, so it's important to use it regularly to get the most benefit. Remember to take it at the same time each day and do not take it for more than 7 days unless directed by your doctor. If your condition lasts or gets worse, or if you experience bleeding from the rectum, be sure to consult your doctor for further medical assistance. If you experience gas or stomach cramping, make sure to tell your doctor or pharmacist. Remember to take this product with at least a full glass of water or other liquid to prevent choking. If you experience symptoms of choking such as chest pain, vomiting, difficulty swallowing or breathing, seek medical help immediately. Although serious allergic reactions to this drug are rare, seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice any other effects, consult your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects. You can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, and report any side effects to Health Canada at 1-866-234-2345. Before taking Konsyl Formula D 3.4 gram/6.5 gram oral powder, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any of its ingredients. This product may contain inactive ingredients that can cause allergic reactions or other issues. Also, let your doctor or pharmacist know about your medical history, especially if you have had stomach or intestinal blockage, difficulty swallowing, appendicitis, a sudden change in bowel habits lasting longer than 2 weeks, or bleeding from the rectum. Before undergoing surgery, inform your doctor or dentist about all the medications and products you use. Some products may contain sugar and/or aspartame, so if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to avoid these substances, be cautious and consult your doctor or pharmacist before using this product. If you are pregnant or breastfeeding, consult your doctor before using this medication. Now let's talk about the drug interactions of Konsyl Formula D 3.4 gram/6.5 gram oral powder. It's important to note that drug interactions can change how your medications work or increase your risk for serious side effects. This powder may interact with other medications or herbal products, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to consult with your doctor before starting, stopping, or changing the dosage of any medicines. Always seek your doctor's approval before making any changes. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. For U.S. residents, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Make sure to keep all of your medical and lab appointments. To prevent or relieve constipation, it's important to make some lifestyle changes. This can include exercising, drinking enough water, and eating a proper diet with fiber-rich foods such as bran, fresh fruits, and vegetables. If you're unsure about what lifestyle changes might benefit you, make sure to talk to your doctor or pharmacist for guidance. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Konsyl Formula D 3.4 gram/6.5 gram oral powder, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. Make sure to keep all medications out of reach of children and pets. It's crucial not to flush this medication down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.